just to put it in a little bit of context, this work around Coffee and Connections really came about via, well, a couple of things, really, areas. So it's been in relation to some staff feedback predominantly, but I'm thinking from a few sources. So just going on to, I'll talk about where it came from and what it's about before then talk about how it actually works. So in terms of staff feedback, we've had feedback from, well, there's feedback that comes via the staff survey every year. There's also feedback that comes that we got through Listening Into Action, really at the start of Listening Into Action, when we did what we call like the pulse check, where we surveyed, everybody in the organisation if they wanted to participate, and we got 1,500 comments really on things that people didn't feel very happy about the trust, or ideas to improve things, and some of the feedback, not all of it, but some of the feedback was very clearly focused on how within the organisation a lot of staff can feel quite disconnected from the wider organisation. So really, the organisation outside of their immediate work areas. And they talk about sometimes it's quite difficult to get to know people outside their immediate work environments, and particularly if they're new in the trust as well. And it just depends where they work, how much opportunity there is to get to know people. But people, recognise that can really present a lot of challenges at times, that sometimes depending on sometimes like your personality or whatever, it can be quite difficult to just pick up the phone sometimes and talk to people, and people tended to work in silos really. And then what often, I guess we're only talking about the negative side of it here, but then what often can happen is that people work within their own areas and don't really understand what happens in other teams or functions, and sometimes people can feel quite not very valued by colleagues, and a lot of that is about just not really understanding what other people do or who they are, and getting to know people. So we've got a lot of feedback about that in various forms over the years really, but we're focusing on more recent feedback. And then the other big area where we got this feedback was from, so probably some of you will, hopefully everybody's aware of the organisation culture work that Rita Evans is leading on, and as part of that there was quite a few sort of semi-structured interviews that were done with a whole range of staff in the trust, and again similar themes came up. So we've just been really pulling together where the feedback has come from. And so in terms of then why this is important, well, what we're really focusing on here is really about the cultures within organizations. And we obviously know that for there to be a good, well functioning, healthy culture within an organization, that probably absolutely the most important thing is around the around staff relationships, and the how we can support and enable healthy and positive working relationships between people, and that this is absolutely crucial if we are going to work collaboratively. Really crucial if we're going to understand and value each other, and if we're able to respond to change. And I think that's really key as well at the moment, particularly over the last few months really with COVID. I mean, obviously this work that we've been doing around Coffee and Connections isn't a response to COVID working, but I think it really fits really well here as well. But I think you know, if we're looking to sort of like transform our organisation and help our staff to transform the organisation, then what we really need to do is to enable and support good, flexible working relationships. So not going to go into all the theory and the evidence base around culture, but that's just to give a flavour really of it. So bearing in mind that was the feedback, then, you know, why we're interested in culture. So what we then decided to do was to try to sort of tailor a specific evidence-based intervention which already exists, tailor it to our organisation and our needs. And the intervention that we chose is one that some of you may already know about. It's called randomized coffee trials, so shortened to RCTs. So for those people here who might have a research interest or background, I mean, RCTs, you know, does stand for something else really often in our sort of environments. But randomized coffee trials are an OD, organisational development, evidence-based intervention, and basically it's exactly based on the principles that I've just really been talking about culture, so, and how you can influence that. So the idea about randomised coffee trials is that you know, they have been proven to, you know, help to form and develop relationships across broader sort of systems and teams and services within organisations, and really help to I suppose increase you know, collaborative working and breaking down those silos. And we didn't want to call it, as I say, randomised coffee trials. We decided to call it Coffee and Connections. So the way that it works, and I know that some of you here already know that, how it works. I know that some people have taken part already or are about to take part. But the idea is that we know that, you know, there'll be a lot of people in the trust who, as somebody said to us, would absolutely run to the hills about something like this. They would absolutely not want to participate, and you know, really outside of their comfort zone. And we totally acknowledge that and appreciate that and recognise that well, any intervention, but you know, this intervention as well is not for everybody. It is one of many which we can use, and it's just here as an opportunity really for people who do want to take part. So the idea is that what we've done over, I think, was it September, Debbie? We put out some communications in Connect for a few weeks, talking about this and inviting people to come forward. And the idea was to say that, you know, if you're interested in basically being paired up with another person, probably, well, hopefully somebody that you don't really know that well, because the idea is about trying to get to know somebody else, and you're happy to be paired up, and at some point throughout October, so anytime in the month, for the two of you to just arrange to have a chat, a conversation. It doesn't actually have to be a coffee, you know, it could just be a chat. You could eat your lunch together. The conversation doesn't have to be about work. It could be about just, you know, getting to know each other. It could be about anything really. But we're just encouraging people to do that throughout October, and maybe, you know, just half an hour. You can have longer if you want, it's up to you, but it's not meant to be anything, you know, any more formal. It's just supposed to be a getting to know somebody in a different part of the organisation. And that is what is currently happening now. And what we are planning to do is that in November, yeah. So back in when this finishes, then in October, sometime in November, what we'll be doing is we'll be hopefully getting some feedback from some people, if they're willing to do that, who've taken part in this initiative throughout October, and just to get some feedback about well, what it was like, what the benefits were, if there were any. Obviously, if there's things that people think that we can do to change or improve this, then we'll absolutely look at that as well. And you know, if there's some positive messages from this, then we want to use that in our comms, so that then what we will do is advertise it again in November with a view to people coming forward to take part in December. And the idea is that to build on this really, you know, every 2 months really, so to operate it bi-monthly, and hopefully see where we get to in terms of well, I was going to say outcome really. It's difficult to know with a lot of OD interventions what, you know, what particular intervention leads to what particular outcome. But you know, there are different ways that we do measure you know, outputs, outcomes, culture. So I think we're just really keen to see how this develops. And it's great that Annie's joined, because I know that Annie has already taken part in this, and Annie said that she'd be quite happy today just to, you know, say a few words about what it was like, or if there were any benefits as well, or what it was like. So are you happy to say anything now, Annie?
Yes. Sorry, I'm getting a bit of echo here. You know, it was good. We spoke about sport. So I was matched with Richard Bulmer. So I think we organised it for around lunchtime, whenever was convenient for the two of us. It was only short, maybe 20 minutes, and I think we spoke about sport, the interests, you know, that we had. Richard asked a little bit about our service and, you know, what, you know, how it had been through COVID. He'd just been for his flu jab. So it was all kind of, you know, it was lightweight, you know, it was fun, and it was good to kind of, because I've heard the name a lot. So it was good to put like a face to the name.
Oh, right, okay.
Yeah. So that was really helpful, because in a big organization, you hear about lots of names, but actually, you know, you might never get to meet them. So it was a really good opportunity to do that. And actually, I think going forward, it could really be developed, and it could be a real opportunity, you know, for people in sort of senior management like Richard to hear from people kind of on the ground like me about where the tensions are, and, you know, maybe hearing about what maybe how I think I'd like to solve that problem, or, you know, what opportunities might be happening in the third sector that the trust could get involved with. So I think the one that I was involved in, it was fun. We didn't really talk much about work, but I could see how it could really be developed, and there could be that cross-fertilization of ideas in the future, if or you could theme them, you know, this one, you know, you talk about leisure and fun things, another one you might want to talk about you know, sort of business or whatever, or clinical stuff, you know. So yeah, it was good fun. Yeah.
Okay. Yeah, great.
I'd recommend it, especially for new people as well, because it's a good way to network.
Yeah. No, that's really helpful, Annie. Thank you. Yeah, I mean, we'll definitely pick up on your experience going forward as well. Joe, I see you've got your hand up, Joe. You're on mute, Joe.
Oh. Ah, there we go. Sorry, it was stuck on mute. I couldn't get it off mute. No, sorry.
I didn't know if it was my connection or not.
I thought someone was trying to tell me something. Yeah, no, I was just wondering, just listening actually to what Annie just said then about, you know, like you hear of a name, but you know, can you kind of sounds a bit like a dating agency, doesn't it? So I've got to be careful how I say it, but
I'm very good at that sort of thing, Joe.
Yes, I've got to be careful with this. But can you kind of recommend can you kind of request what you're looking for? So I don't mean like in that, but
the Tinder of SHSC.
But you know what I mean? Like you might want somebody in terms of, you know, actually you want this as an opportunity to talk to a senior manager, for example. So you might not actually mind who that is or what it's about. You just want that connect to go, I hear about these people at Forward. I'm based over at Longley. I don't mind who, I just want someone from Forward. Or it might be, you know, can you kind of request, you know, how does it work in terms of that? Because, or do you kind of assume who might know who, or how does how does it work?
Yeah. Okay, so I guess we can certainly think about and take on board what you've asked, Jo. In terms of how we have done it so far, we haven't done it in a completely randomized way. I think often when randomized coffee trials are run, and in NHS organisations, in lots of private organisations, I think they're often run with a more homogenous group of people. So you know, it might be like people who have gone on to like a leadership program. So people are more similar. And I think then it's just like, we'll randomly allocate people because it doesn't really matter how to match. But what we did with the people that came forward, we tried to match people who we thought probably don't know each other. There was nothing about rank or position as such on this first occasion. It was purely around we just wanted people to hopefully have a conversation with somebody they didn't know. But we could think about how we develop it. I don't know what your thoughts are, Debbie, about that at this point.
Yeah, I think that's right. It was probably more based on geography than anything. So if somebody was based at Forward, we'd try to match them if somebody worked somewhere else.
Yeah.
But yeah, I think it's definitely something to think about, and it'd be good if we got more people to sign up, and then there was much more of a mix, and it could be more random.
Yeah, thanks. Lee?
Hi, you're right. A couple of observations. So the first one is, you talked about measurement and like the outcome. How do you measure this? Because it's so difficult, isn't it?
Yeah.
And like ultimately what you're trying to do is change culture, aren't you? And this alone won't do that. So that you can't correlate this with a change in culture. And I think that's okay. I think we get too worked up sometimes on outcomes, and actually we should just trust that people making connections with people that they haven't met before is a positive thing. So I'd be tempted just to measure and record how many new connections are made, do it that way. And the most valuable outcome, I think, is for me just hearing from Annie about her experience. It's probably made me think about it differently and in getting more engaged. And then just the final point is I just think well done on taking this step, because I admit when I saw this, it was something that doesn't naturally sit with me, and you've acknowledged that it's not for everybody.
Yeah.
But actually what I've learned throughout this week in particular is, if we're going to change the culture for the better, we need people to be brave and come up with initiatives that don't tick any of these boxes. And so like we've had mindfulness, we've had yoga, we've had poetry, we've got coffee and connections, and they're not all my cup of tea. But listening to some of the feedback from other people, they've got so much out of it. So I think we just need to be braver and have initiatives like these. And in terms of spreading this, I think you can't beat hearing stories from the likes of Annie, because you can put me down for the next intake if you like, because actually it's changed my perception of what it'll be.
No, that's really helpful, Lee. Thank you. And I think using the word brave, I think Debbie and I can relate to that, because I think, you know, we thought this was quite a brave intervention or initiative, or whatever we're calling it, to actually put out in the trust. And we know that there's a lot of cynicism in the trust, and you know, and that's irrespective of whether people are more naturally introverted or extroverted. But we felt, well, let's just launch it and see. So yeah, I think there is a bravery in this and that. So thanks, Lee. Annie, did you want to come in on that before I come to Richard? Sorry, because you did put your hand up, I think.
Yeah, no, I guess it's about also encouraging maybe your healthcare assistants and your cooks and everybody to get involved. I guess keeping it lightweight, it makes it less daunting, but ultimately it's also a great opportunity for development, so it's about teasing apart which ones will be for fun and just kind of getting to know more people in the organisation and finding common ground between each other, and then which stream of coffee connections might add to organisational development. But of course, getting all the voices involved is really important in that.
Yeah, great. Thanks, Annie. Richard? You're on mute.
Yes. Yeah, just a quick one, because I know that we've only got a few minutes left, and at the very least, Joe and I have a meeting to be getting to. The first thing I wanted to say is, as Ailish said in the comments, I was matched with her, and we had an absolutely wonderful conversation. It was a really, really good experience, and we obviously got chatting about what we did in our jobs and what we were doing in our life at the time. I think it is really, really pleasant. But the other thing, I just had a question. Would you be willing to say about how many people sort of took part this time round, and how many people you'd be hoping for next time round?
Yeah, of course, Richard. 20 people this time. So yeah,
That's pretty good.
Yeah. We didn't even know whether we'd get anybody, Richard.
Yeah.
So, we might. I think it was about 20, Debbie. Was it in the end? A couple of people came forward later as well. So we've been just trying to. We've let them know that we closed, but we're trying to find people for them. Then they can still be included. So yeah. I don't know about next time what we're hoping for. More than 20, I would say. Yeah, maybe try and double it. Yeah.
I think you've got 3 so far with me, Joe, and Lee. So let's hope for twice as many.
Okay, thanks, Richard. Debbie, did you want to come in?
Yeah, Joe's got a hand up as well, I think.
Sorry, Joe.
I'll let Joe go first.
I can't hear you, Joe.
Oh God, determined. That's the first time this week I've done that, and it was my fault then. Yeah, I think it's just picking up on what Lee was saying actually, and I've put it. Sorry, I'm just putting loads of stuff in the chat here, but I think it's definitely something new for our organisation. I think where we're currently at, people even finding time to join this session, I mean, the numbers are small joining this session, and I think people will look and go, have I got time to come and listen about coffee and connections for half an hour, let alone be part of that? And I think that's where the culture is at. However, I totally agree with what Lee's saying, and absolutely, I think we've got an opportunity to just go for these things, and we need to be different. We need to do stuff that we've not done before, because we're inadequate and we are where we are. So it's pointless carrying on doing the same of what we've been doing. And once you get happy staff, I'm not going to say the whole thing because it's a bit, cliche, isn't it? But I think absolutely, it sits a little bit, as much as I can talk, it sits a little bit uncomfortably, but I'm going to put my name down because, as I've put in there, even just an opportunity for me to kind of go, I can take a little bit of a break and have a chat. Actually, when can we do that? So I think this is something we really need to plug. I think it will take a while to get going, but let's keep going at it. Yeah, brilliant.
Thanks, Joe. Debbie?
Yeah, no, I was going to say 20 people in the grand scheme of things is a hell of a lot more than we thought originally. We didn't think this would land particularly well. Would be, again, like you said, something that people would be a bit fearful of, a bit cautious of. But it's, I wasn't going to do this, but I am going to do a shameless plug for the Health and Wellbeing Festival. But as it stands, that's double the amount of people that have come forward so far for the Health and Wellbeing Festival. And while I'm on that note, please sign up, everybody. So yeah, it's amazing that we've got 20 people. So yeah, I think it's great.
Thanks, Lee.
Oh, that wasn't my point.
Oh, what was your point, Debbie?
My point was we need to think about how we when we were talking about other people signing up that might not have had the opportunity so far, is the connectivity issue for people. And I know this is on the agendas of people it needs to be on the agenda for, but just to raise it in this context that that a support worker in an acute ward might not have the tech in order to do this.
And I think just to reflect on that as well, Debbie, I mean, you know, if it wasn't for COVID, we would be recommending, you know, if people face to face, you know, for people if that's what they want as well. You know, that's how I suppose traditionally it's been. So you're right. I mean, we have to think about how we can do this differently as well. Sorry, Lee, were you coming in to wind us up? Are you? Or
wind you up? Yeah. Yeah, I've got to go in a second, but just a couple of further. When you say 20 people, I've put in the comments, that's nearly 1% of the organisation, and as a first test of change, that's we always say start small and then take the learning and evolve for the next iteration. So yeah, I'd take the positives from that.
Yeah.
And the other thing is, what I'm mindful of, and I've heard a couple of times this week, is we're a bit disappointed with the attendance on some of these sessions. But actually, the people that we often need to reach with this work have least control over their diaries.
Yeah.
And I don't know, sometimes I forget that I'm quite fortunate, as I'm sure many people are in this call, that I can put things in the diary and work around it, whereas lots of people in the organisation don't have that luxury. And I think it's how do we enable those people to get involved?
Yeah, absolutely, Lee. And I know Debbie and I have had lots of conversations, and we have lots of other sort of plans in the waiting in the wings, really, for what we were hoping to roll out after Christmas, before, you know, COVID got worse again, and when we were hoping that we could have more face-to-face interactions. And we've got some other interventions that not the same as Coffee and Connections, but you know, there's an underlying sort of premise to, you know, trying to achieve the same sorts of things. So I think we've just got to come back to these things now and think about what will work in our diverse organisation, and particularly, you know, obviously, you know, during COVID as well. But yeah, it's something to think about. Were you wanting to say something, Debbie? You got your hand up again? No. Okay.
On that case,
I think Annie's got a hand up.
Oh, no. Okay then.
Nobody's got the hand. Shall we wrap up the session? Thank you, everyone involved. I've certainly learned something, and you've signed me up. So
okay, great.
So that's probably
yeah. Well, spread the word, and Georgia's going to be working with us as of next week. So Georgia will be helping us to sort of plug this going forward and do some of the communication around it. So that'll be great.
Well, what in that respect, all of these are recorded, so we'll put them the links and then use that to plug, because I think the more people that hear these conversations, the better.
Absolutely.
So thank you everybody for joining.
Thank you.
I look forward to seeing who I'm paired with.